Hi everyone, this is Dr. Praveen Patil here. So today we'll discuss about anatomy of the anal canal. Dear friends, this is the anal canal, which is a part of the large bowel situated between the rectum and the anus. So this part from here to here is called as anal canal, and this is the anus and this is the rectum. When we look into the development of the anal canal is derived from ectoderm and endoderm. So above the pectinate line, so this part is derived from the endoderm and this part is derived from the ectoderm. So the length of the anal canal is approximately 38 mm. So for better understanding, we divide the anal canal into 3 zones. So first zone is having the length of 15 mm. Next from above to downward. So next one is another 15 mm and third one is having 8 mm. So altogether it will become 38 mm. The first zone which starts at here and ends with the anal walls. So it's a pale plum red colored due to the venous plexus deep to it. Venous plexus deep to it is a pale plum red color. There are about 6 to 10 vertical folds of the mucosa are called as columns of Morgagni or called as anal columns. So these are the vertical folds which are about 6 to 10. In some books it is given that 4 to 8. So approximately in between 4 to 10. We have a vertical fold, the mucosal folds. So these folds are called as anal columns, or else you call it as the columns of Morgagni, which are well marked in children. These are well marked in children, but less prominent in adults. Superior rectal artery and veins are prominent at 3 o'clock, 6 o'clock and 10 o'clock position. So this is the superior rectal artery, which is a branch of inferior mesenteric artery. So this, when it crosses the common iliac artery, after that the inferior mesenteric artery, this is the branch of inferior mesenteric artery. Once it crosses the common iliac artery, then after that it is called as superior rectal artery or superior hemorrhoidal artery. So it runs posterior to the rectum and afterwards it divides into 2 branches. So this is the right side and this is the left side. So right sided branch is further divided into anterior and posterior branch, and this is the lateral branch. So right and left, right side divides into anterior and posterior, and this is the lateral branch. So when we look the anal canal, so the common sites for hemorrhoidal appearance are left lateral, right anterior, right posterior. So 3 o'clock, 7 o'clock and 11 o'clock. 3, 7, 11. That is because of these plexus, this venous plexus, corresponding venous drainage. So lateral, that is 3 o'clock, right anterior, that is 11 o'clock, right posterior at 7 o'clock. So corresponding veins drains in this fashion. So those plexus will leads into hemorrhoidal appearance at the 3, 7, 11. So other arteries which are supplying to the rectum are middle rectal artery, which is a branch of the internal iliac artery, and inferior rectal artery, which is a branch of, once again, internal iliac artery, and before that is a branch of pudendal artery. So the internal artery, internal hemorrhoidal artery, it passes through the Alcock canal, that is pudendal artery, internal pudendal artery. So this is then it reaches here in the form of inferior rectal artery. We have three rectal arteries or hemorrhoidal arteries. One is superior rectal artery, and next comes the middle rectal artery, which is the branch of the internal iliac artery, and next comes inferior rectal artery, which is a branch of pudendal, internal pudendal artery, and internal pudendal artery is a branch of the internal iliac artery. So at the lower end of these columns, form a line called as pectinate line. So at the lower end, not at the higher end. This has the lower end, the line which is as an imaginary line. So that is called as the pectinate line. The word meaning of pectinate means coxcomb, and is also called as dentate line. Dentate line means something like tooth structure. So pectinate line, dentate line are the same. So this line is called as the dentate line or pectinate line. And each column connected by the mucosal fold. So if you assume this is the columns, so these are connected by the mucosal folds. So this mucosal fold called as anal walls, and there is a pocket kind of on the outer kind of the structure. So I have taken this one here. So this pocket we consider. So this is called as sinus or a crypt of Morgagni. Anal sinus, anal crypt, or sinus of the Morgagni or crypt of the Morgagni called. And this is the anal gland. So nearly about 8 to 10 anal glands will be there, and most of the glands are submucosal, and some sinuses are opened by 2 glands, and some sinuses are opened by the one single gland. So nearly about, some books says 4 to 6 glands, and some books says 4 to 8 glands. So there are glands. So in most of the glands, not most of, all the glands move into the downward direction only, not in the upper direction. So these are lined by the columnar epithelium, and few glands are restricted their extension in the submucosal area only, and some pierce the internal sphincter. This is the internal sphincter and this is the external sphincter. So some glands pierce the internal sphincters, and few cross through the internal sphincters and come into the intersphincteric space. So occlusion of this sinus or crypt by the stool, then which leads into infection into the gland, and that may form the abscess, or sometimes it may form the fistula also. So this is about the anal columns, anal crypts, pectinate line, dentate line, and the importance of pectinate. What is the importance? So in few books says that this is the landmark of fusion of the ectoderm and endoderm, and this is the watershed area. So lymphatic drainage above this and below this differs, and this part is, most of this part is supplied by the superior rectal artery and drained by the superior rectal vein, and next part is supplied and drained by the middle and inferior rectal artery and veins. So this is considered as the watershed area. And some, even if you do a hemorrhoidectomy above the pectinate line, this is painless, and before the pectinate line, this is the very painful area. And this is the first zone, that is 15 mm zone. This is lined by the columnar epithelium. And after that, this is called as transitional zone. So where there is a columnar epithelium turning into squamous epithelium. Pectinate line is a lymphatic watershed, and two different epithelium meet at this junction, and this divides the superior and inferior rectal vessels. So it's a 15 mm long zone below the anal walls, and this is a transitional zone as I told before, and it overlaps the internal rectal venous plexus. Therefore, this is a bluish in color and ends at the white line of the Hiltons. What is the white line of the Hiltons then? So, this is the internal sphincters and these are the external sphincter. So, this zone, I'll take another photograph. So this is the internal sphincter, this is the levator, this one is the external sphincter. So this is the subcutaneous, superficial, deep, and this is the puborectalis muscle. So the space between the internal sphincter and the external sphincter, where we can on palpation we find a groove kind of structure here. So when you palpate the external sphincter and internal sphincter, in between these two there is a groove kind of structure you feel, that is the white line of the Hilton. And third zone, that is the 8 mm zone. So 8 mm long, resembles the skin of the surrounding region. This is lined by the squamous epithelium. So in this video we have learned, in the brief I summarize what and all we have studied. So we divided into 3 zones. The length is 38 mm, and this is the first zone, a 15 mm zone, and the second one is the pecten zone, that is a 15 mm zone, and the third one is the 8 mm zone. So total length is 38 mm, and this is the anal region, which is supplied by the superior rectal artery and drained by superior rectal vein, and this part is supplied and drained by the middle and inferior rectal artery and vein. And we have learned about the what is the pecten, what are the anal columns, what are the anal wall, and what anal wall is also called as the pecten line, and it's also called as a dentate line, and mucosal folds, that is the anal wall, and having the crepts in between. So those crepts are nothing but the opening of the anal glands. So anal glands is lined by the columnar epithelium, and nearly about 4 to 6 or 4 to 8 glands will be there, which are lined by the columnar epithelium, and blockage of this will cause the infection, and later on may lead into abscess formation or sometimes even in the fistula formation. And this is the transitional zone, where this is also called as the pecten area, and in which the columnar epithelium turn into squamous epithelium, and this is the third zone. So this is all about the anatomy of the anal canal. So if you find this is a worth value, then kindly subscribe to the channel and send to the needed people. Thank you. Thanks for watching my video.